Okay, Dr. Kiran here again, catching back on language of medicine. In a previous video, I've told you an introduction of why we are trying to do for your personal use, for your professionals in XT on what we are going to do about it. So now we are starting with the volume 1. In that, the first chapter, that is known as basic word structure. Then the next chapter is bodies pertaining to whole body you're going to have. Then suffixes, prefixes. We're going to learn about all this in the first introduction chapter. Okay? Ready for first one? Alright? Okay. Scroll that down. Next page, hold on. So for you to have these classes to happen, there are 3 to 3 things you should have for you to learn this chapter. Okay? Maybe if I missed in my introduction point, this is what you should do. That is, 1, you might get this video, or live I'm going to have this session. Second important, either a soft copy or a hard copy of this language of medicine you should have, which you have in your hand, hard copy. Same thing, a PDF or something, a soft copy is necessary. Along with the video, go through this along with me. That will make you to understand page by page. I'm going to go about it. Okay, majorly I'm going to touch base on it, go about it, alright? Then, post that, along with that, there is some exercise in the last part of it that you need to solve by yourself. If you do those exercises, it is nothing but a recap of what you've done. It's important. Those exercises is nothing but your homework or modernly known as assignment. Okay, are we good? Did you understand the basic one? Now we'll get started. As like the previous video I told you about, how is this personal views, like different terminologies. The very first chapter, in the first objective is, do not try to memorize this. Try to understand this and a day-to-day using it. Okay? In that way, we are going to divide the entire medical words into different parts, and then we're going to try to analyze, and then you will go to use it. Okay? That every medical term, the Latin word, is divided into either 3 or 2. What is that? You're going to learn. Okay? Going to your next page. The second page talks about, I'll just give you a touch base on that, like ileum, it talks about nothing but, it will sound similar, and don't worry, you are not going to face this. This is for transcription actually. This book was designed for transcription. We are trying to modify it for your CPC. Now what is CPC? Certified Professional Biller. Similarly, you guys will have CPB, Certified Professional Biller, which will also have CPC questions. Okay? It will sound similar, spellings will be similar, watch out careful. Like ileum. One ileum is for your crest bone, that is your hip bone, whereas another ileum is a part of your small intestine. Okay, one more. Ureter. It sounds similar, but again for transcription, urethra, ureter, kidney to bladder. Bladder and away is urethra. Like a kidney stone is there in urethra. Where? Is it in ureter or is it in urethra? That time it's important for us to read about it, okay? Don't worry, these terminologies, some of it when I'm talking, starting first time it might be difficult for you to listen, for you to understand, but I'm going to repeat it so frequently that you're going to memorize. So when you are attending or listening to this session, use this URR technique, not RRR, URR. That is, first only try to understand. Don't try to remember. Second time, when you go through this video or when you read it again, you will try to remember. And when you do your exercise and when you do your last part of it, that time it will register with you. Did you understand this URR technique? Okay. Now going ahead, next page. Here, word analysis is what we're going to do. Like the word first one, you have something known as hematology. That hematology is divided into 2 parts, into 2 to 3 parts over here. First, you have is hemat / logy. Logy means study, like this. But there is one more rule here which we follow. That is, we read from the end to backward. Okay. These 3 parts. The first part of the main subject is known as root, and then there is something known as a vowel. Have you heard vowels before? Tell me. Oh, fantastic. Yeah? You're all super fast people. A, E, I, O, U. Now, what are the others known as? Consonants, okay. I'm not teaching kindergarten stuff class over here. Yes, that is known as consonants. Alright, so we have vowel. That is a combining vowel which comes between a root and the last piece is known as suffix. Did you understand? Very simple. The main hamad is known as root, then you have combining vowel, then you have suffix. How do we read this medical terms? From suffix to root. That is study of blood. Hamad means blood. You got it? Alright. So if you have a root, root is usually is called as, these terms you need to learn this, it is known as the foundation of a medical term is known as a root. Alright. Similarly, suffix is a word ending. Combining vowel can be between root and a suffix or can be between two roots also. We're going to come back to it later. There's another example, little bit extra. Or these two terminals will come and there is something, a word which can come before the root, that is known as prefix. I'll come back to it later. Okay, till now with me? So you have a root, combining vowel and a suffix. Okay. Then electrocardiogram. Remember I told you were going with the word can be a bit longer here. Electro means electricity of this. Again, there are two roots over here, elector and cardio. And there is a combining vowel between elector, cardi and also gram. Okay? So there is two roots and one suffix. Between two roots, there is a combining vowel. Alright? Electrocardiogram. Okay? Electro means electricity, then cardia means heart, then gram means study. Okay? Study or we have different terminologies where it comes. Record. Okay? There is something known as record. Then is there electricity inside the heart? No. You will come to know when you do a cardiovascular system. Yes, there is, but that is going to come in a different chapter. We're going to go about it. Here, we're going to record ECG. Now, we heard ECG. Like that, we have EEG. Now, so they say EKG or ECG. C can also come as K. Cardi. Okay. ECG we have heard. That is a full form. Remember ECG? They will tell you it is nothing but the electric impulse. How, what, everything we'll read it in cardiovascular system. Let us not go so depth in the very first chapter. So now we're going to record the electrical activity inside of the heart. This is known as ECG. Are we clear? Simple? Next. Similarly, there is a second. This is the first rules over. First one is only two. Second rule over. Now there is a third piece. As we go, we're going to go little bit more detailing of it. Okay. Gastritis. Have you heard gastritis? Yes. Gastro. Actually, it is gaster, O and itis. Itis means inflammation. Gastro means stomach. So how should you read this? Gastritis means inflammation of stomach. You understand this? Gastritis. What itis? Like that, we're going to have many itis, you're going to hear. Okay? So now, there is one more rule in this medicals, that is, whenever, you see this gastro and itis, whenever the suffix starts with a vowel, then you don't have to put again a vowel. We need to drop the vowel. It is not gastroitis. It is gastritis. Are you able to understand? Whenever the suffix starts with a vowel, we need to drop the combining vowel. This is an important sum of the rules, right? That's why it is gastritis. Simple? Till now with me? Now going about it, you have heard during this summer or during this, right, you hit outside foot, then you will have a problem. Then what do we have? Gastroenteritis. That is the next word. Here, what are the two roots here? Gaster and enter. Itis is inflammation. Watch out. This is a good example. Between gaster and enter, there is a combining vowel between the two roots. What is gaster? It is stomach. Entero is small intestine. Intestine. Okay, after this one. So between those two, there is a combining vowel. Whereas between the entero and itis, there is a suffix starting with vowel. So we drop the combining vowel there. We don't use there. So what becomes? It is not gastroenteritis. It is gastroenteritis. Now what is the meaning of the word? Inflammation of stomach and intestine. There is also one thumb rule. According to the normal structure of the body, the intestine doesn't come first, right? It comes after stomach. So it is going to go according to the hierarchy, it is going to follow. Alright? So that's why this word about gastroenteritis. Okay? In your bottom line, can you see in the bottom at the edge of your page, you have a summary of this. Very simply, this is important. Remember in your school days that there should be question and answers, I don't know when this happened. And if there are few questions you used to mark it as star. Definitely this will come in your exam, right? Have a teachers told you? Okay, similarly, that is important. Please make note on the summary. Remember the general rules. Read the meaning of the medical term from suffix back to the beginning of the term and across. That is the first rule, right? And the second one, drop the combining vowel before suffix. Whenever the suffix begins with a vowel, it is gastritis, not gastroitis. Next part. Right. Keep the combining vowel between two roots. That is gastro and listen. So between the two roots, that is the foundation of the medical terminology. You need to keep it. All right. Then, in addition to this root and suffix combination, there are two other vowel word parts commonly found in medicals: the combining form and combining films. Now, for us to read about this, the combination of a root and a vowel, what it means, the combining vowel is known as combining form. Okay? What is combining form? The root and the vowel. Like hemato. Hemato is known as combining form. And that paragraph it is written, right? The combining form is simply means that plus both of them will come together. Below, gastro means stomach. We don't say hemat. Hemato. We always use the combining vowel with the root. Okay? In your chapters as we go further, other than the basic introduction, in every chapter is designed like this. There will be an explanation of the entire chapter, basic information. Then there will be an exercise which I will tell you and you're going to write the meaning of it. That is combining forms first part. Then you will have some prefixes, some suffixes. And we're going to write along with my explanation. Are you all clear? After that, you will have your exercises. So every chapter will have first part of this. Some basic explanations will give you out of the chapter. Then we are going to go over combining forms, prefixes, suffixes. Either way, suffixes are something like this. You're going to have cardio, means heart. Okay? Hepato means liver. We have liver, right? Like that. We're going to have hepato. Oto, ear. Okay? So now, I said you have to use your language in your day-to-day life. Like, what do you have something new on your auto? Means what? You got it? Okay? Okay? I have rhinitis. What is rhino? Continue. I asked you about rhinitis. I'm suffering from the rhinitis. What is rhino then? Rhinoceros, remember? So rhinitis is inflammation of cold. So you can always give to your team leader and say, as I'm suffering from rhinitis nearby, okay, I will not be able to make it to the office today. But unfortunately, they also know coding now. They also know medical terminology. Maybe in your school days or college days, you're going to use this, something differently. But for us, like this, okay? I'm trying to give you a bird's view only first. As we go, I'm going to add up the complexity or a little bit of a detailing more. There are some more rules to happen. Okay, how the suffixes is going to come. All right, combining forms. Now we'll go for. Did you understand? There is one more word coming as subgastric. Okay, Now if you divide this word, it has all the three parts. Remember I told you, there is going to be a root, combining vowel, and there is a suffix. Now we are adding one more, who's comes the head, prefix. So a medical terminology can have all the three. That is prefix, root, suffix. But prefix is not mandatory in every stage. It can come only with root and suffix. Mandatory. These two will always be there. Okay. Prefixes will come sometimes that will give a particular meaning behind it. Like, what is gastric? Like the way the last one is a suffix. Okay, IC is a suffix. The meaning of IC here is pertaining. Pertain means pertaining to. So what is only gastric? Pertaining to stomach. Sorry, gastro is stomach. Pertaining to stomach, gastric. Alright. Now why is it not gastro-ic? The vowel starts with suffix. That's why it is gastric, it is not gastroic. Did you see that rule? Again, that rule I'm taking. Now, there is one more known as subgastrics. Sub here is under, below the stomach. Okay, under the stomach, pertaining to, how do you read this? Pertaining to below the stomach. Similarly, we have epigastric, pertaining to above the stomach. There can be sometimes pain or something that could happen. Epigastric pain is one of the commonest complaints you're going to read in your medical records. Epigastric pain, commonly misinterpreted and think there is a heart attack. Alright, epigastric pain we're going to got. That is going to come. So now the suffix IC, like this IC pertain to, we'll have many medical terms, not just IC, even AM. Also will be means pertaining to. Okay? Making sense? Right now, I'll again go back, use URR. Now what is URR? Only understand. Don't try to remember now. I'll keep on emphasizing this. Are you able to understand? Don't worry whether you remember or not. We're going to repeat this again and again. Are we good till now? Yes. Okay, going other. Page. We get the definition. Root is the foundation of the term. Suffix is a word ending. Prefix is a word beginning. Simple kindergarten stuff, man. Come on, it's easy. Alright, next row. Combining vowel. Usually that links root to suffix or root to another root. Okay? Next, combining form is a combination of root and a combining vowel. Till now. So whatever you did, in 4 lines it is over. Clear? Okay, continuing. Combining forms, suffix and prefixes, as I told you before. We're going to start explaining some more medical terminologies now. Alright, basics ones. If you scroll down, previous examples you have seen, okay, here. I'm going to, so these, like this, you're going to have a combining forms. What does that mean? Then what is the terminology? What is the meaning? You will have to write. This is an important piece. As I'm going to tell you, you're going to write. Like, only combining form. Remember, combining form is root and vowel. Like, adeno means gland. Any glands in our body. We'll have 2 types of gland, exocrine, endocrine. We're going to read about it later. Right now, you're going to have adenoma. Here, not that om, this is oma. Okay, oma means what? Tumor or a mass. See, anything in a moderate is okay in our day-to-day life, so is in our body. Anything less or anything more is a problem. That is what we'll call it as tumor. Tumor means again it will have different stages. One slightly more. Okay, that is okay, we can manage off. That is known as, which is manageable, can means milder stage is known as benign. Whereas it is gone to the other parts of the body is known as malignant. Okay, did you understand? Cancer can be for a small one which can be treated. Maybe medicine or some basic surgery or somebody can be done. That is known as benign. Then you have more is known as malignant. So now a benign tumor of a gland is known as adenoma. So you're going to say tumor of, you're going to write down as tumor of gland. Some I'm going to explain, some you should write yourself. Like adenitis. Can you write it? Can you tell it aloud? What is adenitis now? What is itis means? Inflammation. So how are you going to write? Inflammation of gland. Adenitis. It could be any other name. So it is known as inflammation of gland. Arthritis. The meaning is that? Fantastic, very good. Inflammation of joint is arthritis. Now did you understand? I'm suffering from arthritis. Usually old age people or somebody will be having this arthritis, right? So you got it. We're good with me? Can we go further? Bio means life. What is biology?
Study
of life. Biology. Wait. Opsy here. Here opsy means process of viewing. Okay? Living tissue in is removed from the body and viewed under a microscope. Meaning study of living tissue. You can write down as study of living tissue. If at all if somebody has got a problem, to know whether it is a benign or malignant, means it is a mild stage or a malignant stage, we have to take the tissue and then they study in pathology. Path means disease. Pathology, study of disease. Under pathology, there's the people, so they take biopsy, means they take a small piece of the cells of this particular problem of a tissue and then go and study. That is known as biopsy is used. Now I'm not going to limit only to the particular word, I'll try to tell more now. This and I'm relating to something more. And then when you go to the particular topic, this is going to be a repetition for you. Remember in that URR technique, that time this repetition is going to help you. Clear? Alright, let's go next. Remember I told you carcinoma means, that time I told you that time adenoma, benign. Here carcinoma is cancerous tumors, means like a malignancy. Remember I told you benign? Here, they have given the explanation then only. From epithelial, here surface of the skin, on top skin is known as epithelial tissue. Of the skin is known as carcinoma, that covers outside cavities and tubes. So it is a cancerous tumor. Okay, it is cancer. Okay, carcinoma can be explained as it's a cancerous tumor of a skin. You can say epithelial tissue. To make it common language, you can mention it as cancerous growth of a skin. Sarcoma will come. That is for your muscle tissue. Alright, that will come as sarcoma. Not here, you're going to read about it later. Next, I think I mentioned that only. Cardiology. Study of heart. Now see, isn't it now we are repeating and you are able to answer? Hold on, like that, okay? Next. Cephalo means head, cephalic. What is IC? Pertaining to head. You with me? Good. Encephalo. I have written there. Can you see that handwriting there? Brain. You can write there only. Brain. One more word is there for brain. We'll come back to it. Psycho. Have you heard psycho? Common. Actually, it is brain only. Psychology. Study of brain. Then you've been using the slang word as he's such a psycho, means he's got brain. What to scold, I'll teach you later. Okay? Next, cerebro. Inside the brain, we have a big part of our brain that is known as cerebrum. Okay, the largest part of the brain. Okay. Now AL also I told you is pertaining to like IC. So cerebral pertaining to cerebrum you write. That's enough. You don't write full, complete, that CV and all is not required. Okay. The detailing will go later. If you go in the very first class, then you're going to go more. Right now, only because we're going to see about CVA, cerebrovascular accidents, and all that. We're going to read about it later. That is only for you to study the remaining paragraph which is written in the text here. Okay. Next. Cis means here to cut. To cutting into. Incision means cutting into. The prefix here suffixation is the process of cutting into. Means we're going to make an incision. Process of cutting into. Write down. Process of cutting into. When you make an incision, why? To see what is there inside. Opposite that, we will have this process of cutting it out. Excision. Process of cutting out is excision. Means you want to remove that part of it. Because it could be extra growth, which you do not want it. So we do excision. There's one more, you write there only. Incision, excision, resection. Resection. Cutting back, right? Process of cutting back. Resection. It will come later. I'll teach you later. But we're going to club some of the terminologies along with its counterpart, like incision, excision, so that you memorize it both together. And resection, cutting back. We're going to talk about it later. All right. I told you about glands. What is the other terminology for glands? Adeno. That time only I told there are two types of glands: exocrine glands, endocrine glands. Right? Now the glands will produce some secretions. It's going to secrete something. That secretion, if it has a duct, like your AC duct, then that is known as exocrine glands. If it doesn't have directly into the bloodstream, if it produces, it is known as endocrine glands. Okay, so glands, see, that is where here this is both. I'm trying to explain to you both. Then we'll get into deeper into this. Exocrine glands examples are tear glands, salivary glands. That is exocrine glands. You can make notes parallelly there only. The book is there. Exocrine glands. Example: salivary gland, tear. Okay. It's here. Saliva, sweat, tears through tubes. It's written there. See, marker. Okay. Endocrine glands is nothing but the gland that secretes within the bloodstream. All right. Or within the itself is known as sense. Example: endocrine glands examples are thyroid, pituitary. Whenever you say pituitary, write base of the brain. Right, pituitary. Put an arrow mark and write base of the brain. That is your master gland. Okay, pituitary gland is known as a master gland. Base of the brain. Then adrenal glands for your adrenal push on top of kidney. Okay, scroll down. Cystoscopy. Cysto means urinary bladder. Okay, or a sac or a cyst. So what is scopy? Process of visual examination of urinary bladder. They have given the explanation below. Scopy means process of visual examination of urinary bladder. Okay. Cytology, study of cells. With me? Okay, the next page. Is it going? Is the flow going proper till now? Okay. Let's scroll a little bit up. Cytology, study of cells. Dermo is skin. Dermatitis, Inflammation. Inflammation of skin. So are you repeating this now? You're able to understand? Okay. Hypo means under. Pertain, IC is pertaining to under the skin is known as hypodermic. So you can write down. Some of the notes you can write it later also because you can come back. You don't have to write everything during this session. Alright. So some of it you can write. Hypodermic is pertaining to under the skin. Don't get under my skin. Don't become hypodermic, right? Electrocardiogram, we have read this before. Record of electrical activity of heart. ECG or EKG. Both C and K stand still cardiac. Okay, cardio means heart. Similarly, if like ECG, we have EEG. Brain. Remember I told you, record of electrical activity even in brain is known as EEG. Okay, ECG, EEG. Encephalo. Remember that time I told you encephalo means brain. Somewhere I wrote it was not there. Then again, so it's come back here. Okay. Encephalo, brain. It is come back over here. Entero, I told you intestine. So inflammation of intestine. Gastroenteritis you wrote. Now, the next word is erythro means red. Right there only. Whenever you talk about cells, always talk 3 cells. For now, for your understanding. You have red blood cells, white blood cells, and the third one? Platelets / thrombocytes. Right there only. RBC, WBC, you can write both. Platelets / thrombocytes, alright? Now what is RBC for? Red blood cells is for carrying oxygen, majorly transporting oxygen. WBC is for defense. White blood cells is for our defense. Now what is the platelets for? For clotting. We're going to repeat this repeatedly, okay? Whenever you talk one cell, you talk about all the 3 cells so that you can remember this. RBC, erythrocytes, okay? Where are we? Okay, there you go. Cyte means cell carrying oxygen in the blood. Remember I told you which erythrocytes you have, or you can just write red blood cells, okay? In cell, that's red blood cell, that's all you write. Don't try to explain this. So sometimes there are some terminologies, you just have to write down what it is. Diagnosis will come. It's not exactly, you can't divide the terminology in that way. You'll go wrong, okay? You can't understand that. Red blood cells, if you know, that's enough. Erythrocytes, red blood cells, if you write, it's enough. Similarly, leukocyte. After erythrocyte, WBC I told, no? Right there, leukocyte. Spelling is L-E-U-C-O. L-E-U-C-O. Leukocyte. C-Y-T-E. Erythrocytes. E-R-T-H-R-Y-O. E-R-T-H. Erythro. E-R-T-H. Erythrocyte. That is for your platelets. Okay. Gastro, we are already done. Gastrectomy. Ectomy means removal or excision. So we will remove the stomach only. There is gastrectomy. So what? Removal of stomach. So is there a process known as removal of stomach? Can we do it? No. We will. When? Question comes when? Yeah, when? Oh, if gastritis, remove the stomach only. Remove the root only. Yeah.
Gastric cancer.
When there is a cancer, okay, when there is a cancerous conditions where you can't treat it, what is more important? Life of a body is more important, or the stomach or any particular organ. We're going to remove it. Then what will happen to food? There is food supplements. The activity of a stomach can be replaced. Currently in the world, most of the problems can be treated. Most of it. That's the whole idea behind medicine. Okay, that's why we all are surviving more. Our life expectancy is increased to 60 to 70. Okay. Okay, this is what in a state of diagnosis. This is an amazing meaning. Okay, I always remember this. Dia means complete. Noso means knowledge. Okay. State of complete knowledge. Diagnosis is state of complete knowledge. You write that state of complete knowledge here. Have you heard diagnosis as, like the way we've been talking right now, gastritis? It is a complete knowledge. Now, how do we come under a diagnosis? Meaning, somebody talks about some problem. Symptoms, we'll call it as. Doctor will ask you, okay, what are your symptoms? They will take that symptoms. Only by that they will not judge. They will also advise some investigations. Okay, get a scan done. Okay, they advise that. Okay, they look at some of it. For everything, there can be lab that can be advised for investigation. Some of it, by the symptom only is enough, basic and all. They will go to advise it. After getting the complete knowledge, they'll come under one particular diagnosis. If you know a particular diagnosis, there is line of treatment. For this problem, this is the treatment which has been tested already. That's why diagnosis is important. Then however this is going to progress, then that is known as prognosis. Meaning, how the disease is going to conflict. Like gastritis, what is the prognosis of a particular disease like a gastritis? It is good. Meaning, as long as you control your spices, salt, and you take treatment properly, prognosis is good. Meaning, you can recover. Some cancer, prognosis is poor. Do you get it? I'm trying to relate that to you. See, right? Prognosis means even before, literally knowledge before. Prediction of an outcome of an illness is known as prognosis. Gynec means woman or female. Now what is gynecology? Study of women. As though anybody can invent it. No. Female reproductive organ, okay? Nobody can study women. Anybody disagrees that? Anybody? I would like to get that. No, gynecology is that you don't start studying women. That is never going to happen. Female reproductive organ, that is what it is, okay? Not women. Don't go directly in that way. Hematology?
Study of blood.
Study of blood. Fantastic. Now, oma means benign, I told you, right? A mass. A mass of blood is known as hematoma. Like, you poke into somebody's business, that person is going to give you a knock. Then you have a blood collection. A black eye, they call it as common term, right? That is hematoma. Again, this is a mass, meaning excess blood accumulated below the eyelid or something is known as hematoma. So, hematoma is a collection of blood. That's enough for you to write. Okay, with me till now. Hepato, I told you that time is liver. Inflammation of liver is hepatitis. Iatro means treatment. So what is iatrogenic? Pertaining to treatment. Remember, I told you, you should always divide that medical term. Don't forget. Iatro is here, then pertaining to treatment. So it is iatrogenic. Pertaining to treatment is iatrogenic. Next, leukocyte. I told you that time. Leukocyte is white blood cells. Whenever a leukocyte comes, you should write the other two cells. Which is it? Erythrocyte, thrombocyte. Right there only. Erythrocyte, thrombocyte. So whenever you see one cell, write the other two cells. This is going to help you to remember. Okay? Nephro is kidney. Nephritis, you can write it later. That is inflammation of kidney. Nephrology, study of kidney. Neurology, study of nerves. Oncology, study of tumor. Oncologist, IST means specialist. Specialist in studying of tumor is oncologist. Okay, there are a few terminologies. You can go back and write. These and all will park it and then will not go for you to write down. Go further in this. Alright? Going down further, ophthalmo is eye. Ophthalmoscope. Here it is, it's an instrument to visually examine the eye. meaning is there. An instrument to visually examine the eye is known as ophthalmoscope. Osteo is bone. Osteitis is inflammation of bones. Then what is osteoarthritis? Bone joints, bone and joints. So that's what is correct. Osteo is bone, arthro is joints. Okay? Patho, I told you disease. Study of disease is pathology. IST is specialist. With me? Pathology is study of disease. IST is specialist. So, specialist in studying of disease is pathologist. Pedo is child. What is pediatric? Pertaining to child. Pediatrician, specialist who treats the children is pediatrician. Remember I told you psycho means mind? Okay, now it's easy. Study of mind. Psychiatrist, studying of mind is psychiatrist. Specialist in studying of mind is psychiatrist. Specialist, IST is specialist. This is a repetitive term. You need to make time, go back and finish this. Do you all understand this? We're going to check back in your next session whether your book is completed or not. Guaranteed. Right? Reno, nephro, both means kidney. Renal, pertaining to kidney. Rhino, I spoke to you before. Sarcoma, I told you that time we had a relationship, right? Carcinoma, pertaining to cancer disease of a skin carcinoma. Sarcoma is connective tissue like your muscle bone. So it is a malignant tumor of a connective tissue is known as sarcoma. Suppose here it comes, resection. Pertaining to prefix means cutting back. Process of cutting back is resection. What did you write with resection? Excision, incision. Cutting out. Process of cutting out is excision. Process of cutting into is incision. Remember I told you sector resection you should write always with the other two. Alright? Next. We're coming to the last two combining forms. Thrombocyte. Remember I told you that time? Clotting. Thrombocyte you should write with erythrocytes, leukocytes. Cell for clotting. Urology, study of urinary tract is urology. But usually for a male reproductive system, urologist is the one who uses it. You can underline that. Now we go to the last two sections of the chapter, that is your suffixes and prefixes. This is how I told you every form. Starting will give you basic, I am repeating this, we talk about basic things, then combining forms will come, then we will follow up with sometimes prefixes, sometimes we're going to talk about some more examples of suffixes, like the way you wrote now, we're going to talk about it, and then some prefixes. Are we good? Let's finish up these last two sections. Suffixes, you've been writing it from before, okay?